Yoga and non-cardio exercises, allies in managing MS symptoms and improving overall health. This webinar is brought to you by Can Do Multiple Sclerosis, the National MS Society, the MS Society of Canada, and Needy Meds. Before I introduce tonight's speakers, a quick overview of the topics we will be discussing. The aspects of an exercise program, including strength training, flexibility, balance and coordination, and stress reducers. Barriers to exercise. Why exercise is important to your health, including neuroprotective agents, brain-derived neurotrophic factors, and cardiac risk factors. Symptom management, including how exercise affects spasticity, fatigue, weakness, balance and coordination deficits, pain, and depression. As well as bladder and bowel effects. Tonight's speakers are Sue Kushner. Sue has been a physical therapist for over 30 years. After earning her undergraduate degree from the University of Pittsburgh, she attended PT school at Columbia University. In addition to providing home care, Sue has been on the faculty at Slippery Rock University for over 20 years and has been a Can Do MS programs consultant for 25 years. With the National MS Society, Sue has served on the Clinical Advisory Committee, on the editorial board for Momentum Magazine, and was awarded Volunteer of the Year in 2006. Sue is also a certified Level 1 yoga instructor and leads yoga for MS classes in the Pittsburgh area. As a nurse practitioner, Lynn Stazzoni has been treating patients with MS for over 30 years. Lynn received her RN bachelor's degree from the University of Ohio and her master's degree in neurological rehabilitation from Boston University. As a clinical nurse specialist, she has been on staff at the Partners MS Center in Boston and affiliated with Brigham and Women's Hospital and Harvard Medical School. Lynn is also a nationally recognized speaker and offers professional continuing education on topics including the therapeutic and medicinal management of multiple sclerosis, symptom management, and promoting resilience in MS patients. Sue and Lynn will be speaking about how to utilize your MS care team. Please take a moment to look at the various members of your team and understand how coordination between all members can be vitally important to your wellness. Sue, could you start us off by talking about how your healthcare team can help?
Who can help me? Again, this goes back to finding the right people. Support groups are great for this. The National MS Society is great for this. MS World is great for this. We like to partner you with a lot of variables and a lot of variety of people who can help you. Nobody is territorial. Nobody gets offended if you leave me for another physical therapist, or hopefully if you find your neurologist is not doing what is needed, find a new person and talk to people. People are so connected now with the internet and with the National MS Society and phones and texting. You just really have to search out who and what works best for you. So explore a lot of options. Find some that you may want to start with that are within your comfort zone. If that gets too comfortable, too boring, or you need a change, either you may be getting stronger and need more of a challenge, you might find that you're getting a little bit weaker and need some modifications. Go ahead outside of your comfort zone. Nowadays there's, ballroom dancing, there's yoga for MS, there's Tai Chi and Pilates and, you name it, it is out there. It's no longer just riding a bike, walking on a treadmill, and lifting weights. There are so many varieties And you can look at this as a new opportunity to find something you really, really might want to try or really love to do. And as I mentioned, the National MS Society is wonderful. Group activities at your local Y or community center, they're terrific. And then keep in mind, if you can't find what you need, chances are somebody else would like that and needs that also. So why don't you be the person to, light the fire and get things rolling in your area? Call the MS Society, call the church, get the word out, and you start something. And then you have to keep in mind, too, that you would like to find activities, next slide, please, that may incorporate all of the things or some of the things that I mentioned previously. A lot of activities do incorporate all of these, and I will talk about yoga, how wonderful it is for strengthening, for balance and coordination, for flexibility, and boy, you cannot take out the emotional and relaxing component related to yoga. There are a lot of studies. I'm working on a comprehensive yoga literature review, and you don't have to be plugged into Medline or any academic online library. You can just go, Google yoga and MS, and you'll see how many hits you can get. You can go to the National MS Society's website and do some searches. So anyways, a lot of these activities incorporate 2, 3, 4 things at one time. And I really like to emphasize aquatic activities also, because in the water you're able to stay buoyant. The water, as long as the temperature is cool, can cool your core body temperature down. It acts to help get rid of some swelling in your lower extremities. As you work hard against water, it can act like a weight, so you're getting strength and resistance as you're working through the water. Again, I've said this many times. I had a patient years ago who said they would love to live their entire life in 3 feet of water. They could cook in their kitchen. They could go to their kids' soccer games. That's not a reality, but water is wonderful. So moving on to the specifics that I had mentioned, weakness. The main thing I would like to emphasize about weakness is identifying the cause. Sometimes you may just be a couch potato. That may be in existence even before you're diagnosed with MS. In fact, sometimes MS is a wonderful diagnosis to get somebody more active and more aware of their health and well-being. So the weakness may come just from inactivity, but it may be a problem, as Lynn mentioned before, due to the neurotransmission. If there's a tremendous problem with neurotransmission and scarring of the myelin, you may not get that strength back. So activities may have to be modified, but we will, we as a profession, especially physical therapists, we would help to identify what the weakness comes from, which moves on to an area of strengthening. This is a really important part of your program that you need to have in your program on a 2 to 3 times per week basis. It can help improve areas of weakness and muscle imbalances, or if you're not able to strengthen a specific muscle, you may need to strengthen areas around it or areas that are going to compensate for that lack of strengthening. Keep in mind, too, muscles burn a lot more calories at rest, so you're burning calories when you're sitting here tonight or sleeping, more so than you would be if it were just fat tissue. So types of strengthening are going to be extremely varied. As I mentioned, there's aquatics. You can use ankle and wrist weights. You can use the Swiss ball. These are all on the next slide. But keep in mind safety and not overdoing anything. This is where, again, the assistance and the guidelines to a program from a physical therapist can be very, very important. And again, with aquatics, you don't have to be a swimmer at all, but you can get tremendous benefits from the water. Weight machines, free weights, kettlebells, weighted balls, all of these things are options, be it in a home environment or a gym environment. And sometimes you may be energized from being alone, Other times you may love to go to the gym where, you're going to get a lot of socialization, and if you miss a week, your buddies are going to say, oh, where have you been? We're missing you. So there's great pluses to being in an outside of your home atmosphere also. And then with strengthening, just make sure that you're getting upper and lower extremities. Core is very important, and yoga, Tai Chi, and Pilates really emphasize the core. And that's trunk muscles, abdominal muscles, back muscles everywhere from the neck all the way down to the tailbone. And it's very, very important to have strong core muscles for maximum efficiency in mobility. Then moving on to flexibility or stretching or range of motion, you want to make sure that you have the full range of motion of all of your joints that you can. Lack of range of motion from weakness or immobility can cause a lot of pain and discomfort, can lead to permanent contractures. I don't know if anyone out there has ever had frozen shoulder, how painful that is, how difficult that is to regain that. Or plantar fasciitis, that's tightness at the bottom of the feet. That can be extremely painful. And if you're ever, at an airport or anywhere, just looking at people, if you look at an elderly person walking by and you look at a 24-year-old person walking by, you can just see the difference in the fluidity of their movement. And the older folks have usually lost some range of motion. They may have forward shoulders, forward head, some weakness, and what a difference in the fluidity of their movement. So moving on to flexibility, again, I like to emphasize that it is an extremely important part of your program. A lot of people just totally ignore it. And the more range of motion you have, usually it is linked to increased balance and coordination while moving. It can also help combat spasticity. Certainly stretches can help. Medications also help with decreasing spasticity. And keep in mind also safety, your safety in doing these activities, and then your safety when moving around. And then I just have a short list of types of flexibility exercises. And again, yoga. I cannot tell you how much I love yoga for all ages, all abilities, disabilities. And we can find just about anything for your ability. And when I say we, I mean hopefully somebody educated about MS in your area. There's also a very nice Yoga and MS DVD. You might want to check with your National MS Society chapter for some checkouts of DVDs. You can go online. There's just so many options now. And then a couple last things about flexibility in the next slide. You might need some help with your stretching of a support partner, a PT, or an occupational therapist. You might need some braces. You might need support in the way of crutches, a walker. But again, have those things assessed professionally before you just grab your great-grandmother's cane, and she was 5'2" and you're 5'9". So just make sure that you're getting the professional input that you need for that. And then we'll go a little bit back to some medications.
Thanks, Sue. So some of the medications that could help with spasms, maybe some of you are already taking them, such as baclofen, or another name for that is Leorosol. It can range anywhere from 5 milligrams if someone takes it once a day or as needed, up to about 140 milligrams total a day. Some people find that they need to space it out. Some people take it all together, depending if they have more spasms, maybe at night when they finally go to bed and their signals start to fire and their legs start to jump in the bed. So everyone can take it, certainly with talking to your healthcare provider and find out what's the best way to do this. Benzodiazepines such as Valium or Ativan can be used to break the spasms or increase flexibility. I don't highly recommend it. It's sedative. It can cause cognitive issues. But if the spasticity gets so painful, it might be worth trying, especially at night. Some non-medication interventions could be acupuncture, which can work to break the cycle and work on the meridians and change the signaling. It works well not only for pain from spasms, but it can also work on neuropathic pain, such as numbness, tingling, and burning. Some people can apply heat or cold packs to break the spasm, which can be very helpful and certainly doesn't have any side effects. There's the TENS unit, which can be used, which is an electrical device that sends signal through the particular muscle area, which can break up that spasm and can be quite helpful. And then yoga, we got to push yoga because Sue is really into this, but I think certainly this can help with spasms. I think that medical marijuana is something in certain states can also help with the spasticity, but certainly needs to be monitored and can affect cognition. So Sue, what about some balance and coordination?
Well, as Liz had mentioned, a TENS unit, transcutaneous electric nerve stimulation. There's also something out there called Bioness. A lot of you may have tried it or heard of it. It's a wonderful form of electric stim that helps with walking. Again, you need a professional to assess you for your needs of it, and then, of course, insurance plays a factor. You know, it's always in the pie, and it's certainly sometimes a big piece of the pie, what will be covered and what will not. As I mentioned already, balance and coordination is extremely important to be assessed correctly, and it goes hand in hand with safety. If you have very poor balance and coordination, you're at a high risk of falling, and the last thing you need is a fall, a break of some sort, casting or surgery to put you out of commission for 4, 6, or 8 weeks, and then you get out of the cast and it's rehab because you've lost range of motion. I'm painting a kind of a dismal scenario, but I want to give you the worst case scenarios to scare you a little bit to stay safe. Make sure that you have the appropriate assistive devices and braces. Get assessed for, if you have decreased sensation or dizziness, why? Is it because you can't feel where your feet are when they hit the ground? Is it because you have improper shoes? Is it because you have hideous, shag rugs still in your house from the 60s? Maybe you need to get rid of that and have hardwood floors, or, maybe you need to get rid of the throw rugs. So just some common sense assessment of your living environment can assist with that tremendously. So moving forward with some balance and coordination activities, I've mentioned aquatics, and again, the National MS Society often has aquatic programs specifically for folks with MS, so the water temperature is great. The instructor knows MS. Harnessed walking can be found in a PT clinic that really helps with safety while you're doing gait training and balance training. I love a Swiss ball. It's a very inexpensive piece of equipment to have in your home. Maybe there's 10% of you are out there sitting on it right now. Helps with posture. You can move around on it safely. They also come in a peanut shape, which you can straddle, which is a little bit safer if need be. And they can be really, really fun. I tell people, when you're cooking your pasta or whatever, walk alongside your counter, sidestepping, turn and walk backwards, holding on to the counter with one hand, because we live in a 360-degree world. You're not always just moving forward. You may be on a soccer field watching your kid play. You may be at the grocery store, get bumped from the side. If you have not stepped laterally in months, chances are you're going to fall. So you really want to be able to move in 3D and 360 degrees in which we live in. So let me sing the praises of my little pet yoga. Again, this is like anything else that we've stressed, is you need to find a yoga class and a yoga instructor or DVD or TV show that works for you. Chances are you want to avoid hot yoga. It's not my personal favorite. Some people really, really love it. Maybe iron yoga is not the thing for you. It's pretty strenuous with weightlifting. But there's wheelchair yoga, there's mat yoga. Even just your basic yoga can be modified for you based on your range of motion, your strength, any spasticity. And again, you've got to find, the PT and or yoga or OT who can help you with that. And it may take some hit and miss. You may go to a couple yoga classes and you think, never again, never again. Keep trying till you find something that works for you. And it is so wonderful for your posture. I teach a silver sneakers class, so it's for older folks, and to see them over just a year, 18 months that some of them have been coming, their posture and their movement is, I used that word before, fluid, so much more fluid than it used to be. And once you learn a lot of yoga moves, it's something you can do when you're watching TV, watching reruns, just 5, 10, 15 minutes a day before you get out of bed or, while you're doing something else. Yoga. And again, the MS Society has some resources for this. Can Do MS has done at least one, maybe more webinars, and I'm sure we'll be doing more emphasizing yoga. Then there's also Tai Chi, which is another form of activity that works on balance and mindfulness and a lot of concentration. This can be also done in a modified format, holding on to, if you're outside, literally holding on to a tree. If you're inside, hands on a chair, on a counter. Any of these activities, though, please keep in mind a cool environment. Chances are you're not going to do yoga outside, Tai Chi outside, walk outside in Alabama in, August at 2 in the afternoon. So you want to make sure that you keep your environment as cool and as comfortable as possible. And that can be done with clothing, drinking a lot of water, the cooling vests, fans. I think a lot of people know what those Schwinn Airdyne bikes are. They're the bikes with the fan in the front wheel to keep cool air blowing on you. And then I just want to mention Pilates too. There's a lot of types of Pilates exercises, and they work on lengthening muscles versus shortening them and building bulk. It can cover all of the aspects of a wellness program that we have covered already. They can be mat exercises, just, again, following somebody in a class or a DVD. Or they can be a higher level of Pilates where you go to a facility that has these reformer tables, and they're wonderful. They're usually more expensive classes because the tables are expensive. But again, talk to support groups, talk to local chapters, and see what you can find that works for you, because what did I say? If it works for you, it works. So then moving on to how to take control. I'll let Lynn take over.
So I think it's really important to stay on the disease-modifying agent that you might be on. Now, there might be some who've tried many and they haven't helped, or some that choose not to do any at all. But I think it's clear that many people need to control their disease by hopefully stopping it from progressing. And one way to do that is to stay on a disease-modifying treatment. So I think that's really important. Have an open, honest relationship with your providers. And if you're not taking the medication and not telling them, it's not of any benefit to you at all. I think that symptom management, as I stated earlier, is a way of controlling the symptoms that you have, and it's very individual. Certainly there are, fatigue happens to most people with MS, about 80%, bowel and bladder management about that same amount. But not everybody has the same symptoms, and then you all know that by talking to your neighbor or talking to other people at support groups or in clinics, that you might have similar symptoms but not exactly the same. So managing those symptoms, whether it's through medication or exercise, doing the Pilates that Sue mentioned, or Tai Chi, or yoga, or mindfulness, all those would give us a way to control the symptoms. I think with exercise, all of us can do at least 1% better than what we're doing. And don't let those barriers that we talked about earlier get in the way. And I think it's really important to be kind to yourself and be hopeful for the future. Sue?
Thanks, Lynn. And as you can tell by the title of this, we emphasize non-cardiovascular, non-cardiac activities. But again, keep in mind that does need to be a portion of your program, if at all possible. It's good for your heart. Your heart is a muscle. It's a very good calorie burner. But please do not overlook that what goes in your mouth is equally important to how much you exercise, possibly even more important from a number of studies that have been coming out in the recent years. You have to have control of your diet. And I don't mean you have to be on a diet. I mean what you take in, the mix of proteins and carbohydrates and fats and sweets. So, that's for a whole nother day, nutritionist and dietitian, etc. But keep in mind that, the benefits of non-cardiovascular activities can be stress reduction and relaxation, mindful meditation, doing things that are fun and pleasurable. You are much more likely to stick with them when you enjoy them versus, total drudgery and, you'd rather have your fingernails pulled out than go do your exercise. So chances are that's a big cue to switch to something else. And as I mentioned, being social. We are social creatures, unless, of course, you're one of the ones who does like to just hole up in their own little corner of their house to work out. And that certainly is a personal choice for each and every person. And keep in mind the bullet points that are on this slide. We really encourage you to look at the archives of the Can Do webinars, which have been going on for quite a while now. And if there's any particular points of interest that have sparked your curiosity tonight, please feel free to look at our archives, because we have a lot of good areas that highlight things that we mentioned tonight. And most everything we talk about goes hand in hand and hand in hand with everything that we do at Can Do MS and other organizations in the world of MS, National MS Society, MS World, and on and on. We are all partners for everybody out there. So thank you.
Well, thank you very much, Sue, and thank you, Lynn, and thank you, everyone, for participating. We are going to take a few minutes for questions, but I do want to note that picture on the slide. This is right outside the Can Do MS offices in Colorado, and we have yoga there every day throughout the summer. So it's not a bad place to be. So hopefully you can find also places of inspiration, and it's a great place to focus on your wellness. So we're going to take a few minutes for questions, and if we don't have time to get to your question today, I am going to tell you about some resources that Can Do MS offers, including opportunities to send in questions to our MS care experts. So we'll get to as many as we can, but if we don't get to your question, there are opportunities to get the information that you're looking for. The first question I'm actually going to answer, because we're getting a lot of questions about whether you'll get a copy of the slides and will it be archived. And the answer is yes to both. At the conclusion of the webinar tonight, in about an hour, you'll get an email with a link that you can go back and look at the slides. And then starting tomorrow afternoon, it will be archived on our website, which is mscando.org. So you can always go back and reinforce and catch anything that you may have missed. So the first question is, we received a lot of questions about different symptoms and exercise and how they relate. By far, the most popular question has been spasticity and the MS hug. So I guess, Sue, do you have any specific exercises or stretches that may be beneficial to spasticity?
Yes. So, of course I can't show them here or, work with each individual patient, but in general, what I'd like to say about spasticity is, again, it has to be identified and treated, of course, with some medications, and the medications are going to be helpful to a point, but there's, let me first say that spasticity can be somewhat beneficial. And what I mean by that is, say your quadriceps, your front thigh muscles that help you stand upright, are very, very, very weak. And if you had to stand just on the strength in your quads, you might collapse to the floor. But if you have some spasticity, some increased tone, you may be able to stand, get out of your chair, and walk due to the spasticity. So a therapist has to work with you to help you figure out how much of the spasticity is actually helpful and what would happen if you took away all of the spasticity. Also keep in mind with spasticity, when you are doing active stretches, meaning doing them yourself, or when they're being done to you, which is what we call passive stretching, stretching with spasticity has to be done very slowly. And this is based on just a reflexive reaction involved with spasticity. If you try and move a body part quickly and there's a lot of spasticity, it's going to just go off the charts and become more spastic. So you, as the patient with MS, and your support partner, your therapist, you have to learn how to move slowly through the range of motion to get the maximum stretch without hyper activating the spasticity. And I'm going to let Lynn add, anything from her end there. And I hope you all kind of understand, get the picture of what I'm talking about.
And I think it's really important what Sue said about working not only with your healthcare provider or your neurologist or NP, but to work with physical therapy, because there is that fine line between how much spasticity you need and you don't need, and that can change from time to time. So working between exercising and taking medications can really be to your benefit. I think about the MS hug, certainly I have seen people who do exercises seems to lessen, and taking, once again, those neuroleptics, which interfere with the signaling, which is telling your body that you're getting that hug when in reality you're really not, can break that cycle and help diminish that sensation.
Great,
Lynn, do you mind, Brian, may I ask Lynn to explain what the MS hug is? Because I sometimes, someone may not experience it or know what it is.
I think it's a great question.
So more or less, thanks, Sue. Literally, it feels in one particular situation that someone is actually squeezing around your diaphragm or your belly. And it almost feels like someone's hugging you. Now, that hugs in most cases can be very pleasurable, but this is a sensation that's not wanted. It's like a tight band. And people can not only experience it around that particular area of their body, but they can actually feel that sort of hugging, squeezing sensation on any part of their body. But that just seems to be a very common area where it occurs.
Yeah, not very pleasurable, like you said.
And another related question, and Lynn, maybe you can field this one, is sensory nerve damage. Is there any research or anything to show that exercise can help that nerve sensation come back, or once there's sensory nerve damage, is there any way to bring that back through exercise or to mitigate the damage?
So sensory means it's a central nervous system disease. So it's the signaling that's getting through inappropriately. So it might be lessened where you don't feel much, or it could be very heightened where a little slight touch of the skin can provoke very painful sensations. So there is some thought that by exercising you can reroute the signaling, and this might be a benefit as far as retraining the system to go around the problem per se. Sue, have you come across any of this in your practice?
Yeah, and I would say also for folks out there, don't forget to tap the expertise of occupational therapists. They do a lot with sensory training, either increasing or desensitizing certain areas of the body, and they can be tremendously helpful in this area.
And certainly utilizing that whole healthcare team that we talked about is very important. So, excellent. Yes. Sue, this is a broad question, and we received from a couple people that they just feel that they're in this trap, particularly with fatigue, that they feel tired, so they don't engage in any activity, and being inactive therefore makes them more fatigued. Can you provide any sort of broad strategies of how to kind of break that cycle?
Yes. Part of me wants to just say 3 words and just do it, but that's just too trite, and it doesn't always work that easily. The thing to do is start in extremely small increments. If you have been doing nothing, you're not going to start 3 times a week, 40 minutes, exercising. But I can just about guarantee you that starting with small amounts of activity, even when working through it when you're fatigued, in a short amount of time, be it several weeks, a month and a half, you're going to notice that you are more energized. You're building up more strength, more cardiovascular strength. You're building up endurance. And, hopefully, like most of us get the endorphin release, get the high a little bit even from exercise. There are some people who the proper chemicals just don't get released, and you just have to plod through it. But just starting somewhere and building upon that initial change in your program of inactivity is going to make a difference, even if it's difficult at times. But keep in mind, listen to your body too. On a day or a couple days where you are just totally wiped out, give in to taking the day off from physical activity. And, it's been a rough winter everywhere for people just being sick. I've had something that's lasted 3.5 weeks. So you have to give in to your body and listen to it within reason. But, yes, starting small chunks, increments, building up slow and steady, and you'll get there. It will combat fatigue.
So do you think that sometimes people say, well, pre-MS, I could do this particular exercise. I can't necessarily do that now, so that's not really exercising, or I can't live up to that, or I can't do that anymore. And I think what you said was so important to say, start off really slow and work up to whatever your abilities are, and not to focus on the path.
And modifying, just really modifying. We've had marathon runners, we've had, national bicycling champions and skiers. And are they going to have to change and downgrade their activity? For sure. But again, if you can modify and find something that gives you the benefits and the emotional satisfaction, you're going to be in as good a place with your exercise as you were before. And I like to mention some people who say they've come to me for PT or they've come to a Can-Do program and they had zero, and I mean zero, activity and exercise in their lives. And the MS has kind of, given them the kick in the butt, and it's jump-started or springboarded them into a new a new realm of activity that they never had before in their lives. And that's really, really neat to see when someone goes from doing nothing to, wow, I'm active for the first time in my life with MS.
Yeah, that's a great point.
Like that.
Excellent. And and another barrier that we spoke a little bit about was body temperature and heat sensitivity. Could you just go in a little more detail on some strategies to burn calories without having to raise the body temperature? And can exercise, are there ways to control heat sensitivity through exercise?
Sure. Just keeping the environment as controlled as possible, be it a very cool room, a cooling vest, cool clothes, the proper time of the day to exercise if you can, hopefully fit it into your life. And again, small bouts of exercise. If you find that you are overheating and fatiguing from it, just take a little break. The break may need to be 10 or 15 minutes till you cool down, and then gear up maybe for another 10-minute bout of exercise, or morning, afternoon, and evening. And, just finding what works for you, staying hydrated, maybe an ice pack around your neck, a wet towel that you just, every 5 minutes when you need a break because you are getting overheated, put that towel under cold water, or grab another cold one that has been in the fridge or the freezer and wrap that around your neck, and make the accommodations that you need to prolong your exercise routine or that specific bout.
You had mentioned earlier, Sue, about if you can and like to go in the water, that's really helpful as well to keep that core body temperature down.
Marvelous, because your core body temperature is shown to stay a couple degrees decrease for several hours after a session in the water. And again, you don't have to be a swimmer at all. You can put a jogging vest on. You can use those $3 noodles, wrap them under your armpits and just go in the deep end, or walk side to side rapidly, forwards, backwards, sidestepping, go to a class. There's so many neat contraptions too. Some styrofoam dumbbells and ankle weights that give you resistance. Yeah, the sky's the limit with aquatic activity.
Yeah, the water is certainly amazing. Excellent. Well, we have time for a couple more questions. We also received a few questions specifically about bowel and bladder function, and if you go into a little more detail on how exercise can help strengthen and relax bowel and bladder, and if there are exercise, if you're in a wheelchair or laying down, are there certain exercises that can strengthen those muscles and those abilities?
Do you do any of this, Sue, with physical therapy?
I don't. There are specialties that deal with pelvic floor physical therapy. That they are certainly therapists that are trained, for some internal massage and strengthening exercises and activities. I mean, I know enough to tell people if they are urinating, stop halfway through and then start the flow again. And certainly it's proven that exercise can help with, keeping you regular with bowel movements. But if you feel like you need some help on the muscular level with the pelvic floor, seek out a physical therapist who specializes in pelvic floor PT. Sometimes we call it women's health, but it's not just for women. So look for the pelvic floor specialties.
And they do use biofeedback, so there is a sense of like looking at the loop of the biofeedback, knowing that you can squeeze your muscles and doing all that. So that's really important to get that feedback, because it's sort of a self-satisfaction immediately knowing that you're doing that. But also, it can't overstress the importance to drink, although if you have bladder urgency and frequency, you think, no, I'm not going to drink at all. But so important to keep the systems working, not only in relation to your bladder, but as well as bowel function, because your body's going to steal that water off of your intestines if you're not drinking it, and then everything's going to dry up and not move.
And you don't want to become dehydrated, if you are working out.
Great, thank you for those insights. transitioning to cognitive health, we received a really good question. It says there's been a lot of evidence showing the benefits of regular cardio on cognitive health, but can some of these non-cardio exercise also improve cognitive health?
I think
I believe
one of these.
so. Go ahead, Lynn.
No, go ahead. Go ahead.
No, because I have to formulate my thoughts.
So I think one of the things is not only to that has been shown in for cardio to help cognition, but I think it's the fact of doing any kind of, if you can do group exercise, that isolation has found to be very helpful in promoting cognitive health. And stress reducing is very important for cognitive health. So I think it's not just the exercise itself, it's the community of doing the exercising together.
Right. And to build on what Lynn said, just some of the routine that is involved with exercise and, as she mentioned, also socialization. Now, the cardiac portion is going to help with, increasing blood flow, keeping vessels open and strong. You're not going to get that as much with flexibility, strengthening, and balance and coordination exercises because you're not getting quite the, boom, boom, increased blood flow that you do from cardiovascular exercises. You're still going to get, of course, increased blood flow because you are moving. But the benefits on a physiological level from the non-cardiovascular activities will not be as great as from the cardiovascular activities. But again, the other things, yoga, Tai Chi, socialization and concentration and, the mindfulness is extremely beneficial.
Excellent. I think that's a great answers. I think we have time for one more question. It's a good way to wrap up this evening. It's a two-part question. Could you point to any specific research or any specific points on the disease-modifying effects of yoga? And do you have any tips on finding yoga practitioners that specialize in MS?
Yeah, regarding the research, I don't have a list in front of me at this moment, but again, I have students just working on something right now, and they started with your basic Google, look up yoga and MS, and you will get a number of wonderful citations from peer-reviewed journals that, anybody can access. And also through the National MS Society, they have resources both for professionals and for clients, for people with MS. You can always ask your PT or yoga instructor, hey, would you mind giving me thus, a few specific citations from journals that might be able to, that can reinforce what we do preach. And then the other portion of the question was finding somebody who teaches yoga who knows MS. That's not the easiest thing in the world, but a lot of times PTs and OTs can incorporate a lot of yoga into their practice with you. Or again, just ask around, and I keep referring to the National MS Society and MS World, particularly in the National MS Society for your local area, who is a yoga instructor that the National MS Society may employ. Sometimes they will sponsor programs locally, or check out, there's so many types of yoga studios now, and see who might have training in modified yoga and yoga with an emphasis on rehabilitation. So, take some searching and asking around, but find someone who's, like Goldilocks, like, oh, this is just right for me. It took me a while because that one was too hard, that one was too soft, and this one's just right.
Or if all else fails, you can move to Pittsburgh and call Sue Kushner.
I don't have the beautiful scene in your last slide, no gorgeous lake here. Well, there's a few, but.
Well, excellent. Well, thank you, Sue and Lynn, so much for leading our presentation this evening, and hopefully you found it helpful and empowering. Thank you so much for joining us this evening. I do want to let you know about a few resources that you may also find beneficial. On the Can Do MS website, we offer, as Sue mentioned, an extensive library of articles and webinars. Ranging from all different areas of wellness. We also do an electronic newsletter once a month, and a really neat feature called Ask the Can Do Team. And that's when you can submit a question to Can Do MS, and we will try to get it answered by one of our MS Care experts and publish it online. So that's a great way to get your question answered and share some knowledge, which is very beneficial. Also, the National MS Society has some great resources on a wide variety of areas, but definitely on yoga and exercise and Tai Chi. And again, you will receive an email with a link to the presentation. Then you can go right to this slide and click on these links, and you can go right to these different resources. So certainly, the National MS Society is a wonderful collection of resources. And then finally, we certainly encourage you to join us every month, the second Tuesday of every month, for our webinar and telelearning series. We try to find different areas of health and wellness and symptom management. And next month, on May 9th, is going to be an interesting topic on visual problems related to MS. Specifically focusing on optic neuritis, double vision, and nystagmus. Visual problems are very common in multiple sclerosis, so please join us to learn about treatment and rehabilitation strategies, as well as tips, tools, and techniques to care for your optic nerves in your central nervous system. As always, you can register for the webinar telelearning series free of charge on the Can Do MS website, which is mscando.org. For those participating live tonight, as soon as we end here, you will see a survey appear on your computer screen. We try to make our programs better and better, so please take a moment to complete the survey and share your input. Your feedback helps us continue to improve our webinar and telelearning series. And again, you will receive a PDF copy of tonight's slide by email. One last thing is we try to put on these programs across the country, both our live in-person programs and our webinars, and we can only do that through the generous donations of our program participants. So if you enjoyed the content tonight and would like to see programs like this continue, there is an opportunity to be part of the team and to contribute. So thank you again so much for joining us this evening, and thank you so much to Lynn and Sue. Any parting messages from our esteemed panel?
So just thank you for tuning in, and thank you for caring enough to, hopefully help yourself, because, this is about you and those around you and your loved ones.
I echo everything that Sue said. Thank you so much for participating and listening to us speak, and please remain hopeful.
I think that's an excellent way to end our evening. And again, thank you all so much, and be well.
Thank you.